Roughly 30 nurses in Edmonton have refused to swab patients for the coronavirus because Alberta Health Services, AHS, won't provide N95 masks, their union says. They believe that when they request one, they should be provided one from the employer without question. They should be provided PPE. They believe that when they request one, they should be provided one from the employer without question. As do I. What is this, 1850? Hospital internist here. The only reason CDC has said face masks, and last resort bandanas LOL, are okay is to prevent massive amounts of healthcare providers refusing to give care. This, IMHO, is the only reason they say that surgical masks are okay. They're making sure that all hands remain on deck. If you don't want to stand behind the nurses, stand in front of them. If one lesson comes out of this, it's that you don't outsource the industrial capacity of entire nations to one place to save a few dollars. Well, you wouldn't expose a worker to asbestos. It would kill them. Same thing with the virus. Where in the employment contract does it say an employer has the right to kill a worker? I saw Toronto nurses yesterday using feminine pads as makeshift masks. Let the administrators take the swabs. I swabbed myself when I went through screening because the RN was not wearing enough PPE. I asked her if I could. I have a medical background and knew how. But I think it is something that healthcare workers could educate patients on, and thus reduce their risk of exposure during drive-through screenings. A patient can be instructed step by step while in their car. Visual aids and literature could be held up to assist in understanding. I did not get tested for the virus because I tested positive for strep. My fever has gone down and I am feeling better. I absolutely gagged when I swabbed my throat, and I would have been horrified if my expelled air would have came in contact with that healthcare worker's exposed skin. Please pass this idea along. Guess what? I wouldn't go into a fuel tank without proper breathing gear and vent. Same goes for these nurses. I cannot believe in this day and age they are not wearing industrial quality respirators with 100% face seal. As an industrial welder, I have done this, and if it can prevent me from inhaling harmful chemicals in their heated state, fumes, surely it will protect from inhaling a virus at 99%, way better than N95 mask for 95% effectiveness. It occurs to me it would be best to have new filters daily, but see no reason why to change during shift unless you know contaminated. The provincial government in Alberta is in the midst of trying to privatize our healthcare system. Money that would be better served in the public space is being reallocated toward corporations like TELUS to profit off public funds. Ask yourself, if you are a nurse, will you risk your life by doing your job without proper PPE? Like I said days ago, wait until this refusal to endanger their lives without adequate PPE spreads to the United States. There is going to be a mass walkout by nurses in some area like the San Francisco Bay Area. Nurses are one of the groups that are best organized for strikes. A lot of nurses are nurses so that they can raise families. They didn't sign up to knowingly risk making their children orphans. Maybe Kenny can test patients himself. Asterisk, if they are not gonna providing masks to medical staff, then who's gonna use that stuff, because most exposed persons are medical staff and they need such equipment more than anyone else. Asterisk. I don't know why people find it difficult to understand. I got downvoted to hell for mentioning that I wouldn't want to be mandated to stay in a place that wanted to treat COVID but didn't want to adequately protect staff. Being a nurse does mean to advocate for people, but nurses and doctors shouldn't have to set themselves on fire to keep people warm. We have to protect ourselves. My wife is a nurse and this is a very real concern for her. She's young and healthy, and I'm sure if she caught this virus she would be completely fine after a recovery period. She's concerned that without proper PPE she will be exposed to this, and as a result I will be exposed to it. She's concerned that her other patients, an older demographic of neuro patients, will be exposed to it. She's so selfless that she's concerned about everybody but her well-being. Normally this kind of swabbing requires N95 and facial shield. Hill, no. Would not do it, either. LOL at they believe, Like it's just a matter of perspective that they need appropriate PPE to do their job safely. As a Hong Konger, PHC really need to wake the fuck up. If you look at how Taiwan and Hong Kong handled coronavirus, you can see why it is exploding in Europe. In Hong Kong, everyone who works in a medical environment, from doctors, nurses to cleaners, normally wears a surgical mask under normal operating conditions. When shit hits the fan, SARS, coronavirus, N95 face shield for close contact, else surgical mask. They also set up dirty teams to reduce the number of staff exposed to patients to coronavirus. Your lack of preparation does not constitute an emergency on my part, has never been more true than now. Hopefully all public health agencies will learn from this. I'm from Edmonton. Our provincial government has been fucking with nurses since before this corona stuff. Our right-wing government is trying to introduce privatization and they're using this health crisis to jerk us around. They just introduced this new health app that charges like 2x as much as the doctor and you don't actually get to see a real doctor for a hands-on checkup. Sleazy rat bastards. Time to start raiding auto body shops. They must be provided PPE. A couple of idiots in another subreddit where this was posted are actually demonizing the nurses and calling it a balancing act between overusing masks and underusing masks. Every day I lose more faith in human intelligence. That anyone would actually argue that nurses and doctors shouldn't be using masks is a kind of stupid that almost physically hurts. Correct me if I am wrong, but isn't this a supply problem? We really need to fix this at the source. ER nurse here. Everyone's saying that she doesn't need the N95 mask as long as she's not in an aerosolized procedure. That's not how the real world works. I'm so fucking angry right now. Listen, these patients should be in surgical masks and it should be properly placed, above the nose and below the chin. Too bad these patients aren't compliant with masks. You have no idea how many times I have to tell 65-year-old men they should cover their cough. They then look offended I did so. They don't like wearing masks and will pull out down when I leave the room. They'll openly cough in the room, aerosolizing their virus. Only, I'll be in another room helping another patient. If they are testing consecutively, like in a drive-through situation, these people aren't wearing masks and you don't know when they coughed last. I know I'm gonna get this fucker. People arguing about what type of mask would be sufficient whilst they're sat comfortably in their chairs or beds. Can guarantee 99% of this chat would never be able to do what these nurses do. What a terrible headline, trying to portray nurses as entitled babies giving orders to poor employers. Of course they must be provided the necessary equipment to do their job. They are risking their health to test people, they have the fucking right to demand protective equipment. PPE is a right in the US provided by employers. My friend works for Nebraska Medical Center, UNMC. She helped a patient Friday that tested positive for corona. They tested her yesterday and she tested positive too. They are giving her the option to work in the corona unit, or go home with no pay. Crazy. I stand behind the nurses 100%. They're not a public sacrifice. This is a perfect example of the beginning of the breakdown. I stand with the nurses because they are right. It's like sending you to war without ammo. And they should rightly refuse. Their lives have far more social value than the average patient's and we've lost far too many medical staff already. This is the Irish potato famine in reverse. In that case one country focused too much on one product, in this case almost all countries relied too much on one country, China, for all its stuff. That is to say, it's incredible to me that over so many countries, both well run and not, this is a problem.